Hello, friends. So we are going to start a new series of podcast on Breathe Bones channel. This is going to be Meet the Mentors series, where we'll be interviewing mentors of different fellowships across the world and know about the fellowship in the institutes and how to get into the fellowships there. So in the first episode of this series, we have Dr. Jang from Gangnam Severance Hospital, Korea. He is in the Department of Neurosurgery, which hosts the Spine Fellowship in that institute. We have Dr. Satish from Breathe Bones interviewing him, and let us hear out what he says.
Good morning, viewers. So, in this another podcast series of Meet the Masters, today we have with us Professor Jang. He's an assistant professor in the Department of Neurosurgery in Gangnam Severance Hospital, Seoul, Korea. So he's going to elaborate us about the spine surgery and its entire course in Korea, how it works, and what are the opportunities and things like that. So over to you, Professor. Please briefly introduce yourself and let us know about the place where you work and what kind of institute you are working on.
Thank you, Dr. Satish Musu. I'm Hyunjun Jang from Gangnam Severance Hospital, Yonsei University, Korea. It is my great pleasure and honor to invite this great meeting, and I was very surprised that how this meeting is ongoing.
Okay, thank you. Thank you so much for the reception. So we will start with the general practice trends. Can you give us an overview, like how the spine surgery practice works in Korea? Like how much is very specialty based, or it is a general practice, as you said? Are the surgeons practicing from cervical to lumbar, both the tumors, deformities, everything, or is it totally subspecialty based? Or how is the divide between orthopedic spine surgery and neurospine surgery practice in Korea?
Yeah, thank you. That's a very good question. As you know, the origin of the spine surgery is orthopedics. So they do a lot of spine surgery in Korea also. But nowadays spinal neurosurgeon is very increasing. So in Korea, uh, neurosurgery spine surgeon is twice than orthopedic surgeon. I think it is because the orthopedic surgeon can choose everything, knee, hip. The total number of orthopedic surgeon is twice than neurosurgeon, but spinal neurosurgeon is twice than orthopedic surgeon.
Okay.
Yeah. Yes. In Korea, the 1/3 of neurosurgeon choose the brain surgery, and 2/3 are choice spine surgery. The in Korea, majority of the pediatric deformity is on orthopedic also. Yeah, and the intramedullary tumor is on neurosurgery, but other deformity and only intradural extramedullary tumor do everything. But such as in our department, like me, junior surgeon, trying to do everything, but we have some specialty. Yeah, for me, I have a specialty for tumor and cervical, but now I do UB and majority is lumbar surgery. Yeah. But I will go later. I'll do the special things.
Okay, yes. Right now you have access to everything.
Thank you.
Okay. Like yours is a university hospital, right? Like what's the healthcare system in Korea like? Like what part is private? How much part is pulled on by the government sector?
Thank you. I think it is some different with your country. I think your country is similar to Europe, maybe, but in Korea is more similar to the US or Japan. So every cost of the medical things are decided by the government.
Okay.
The surgery price, and medicine is decided by the government, but we can use the some materials for outside of the government.
Mm-hmm.
But yes, so in in Korea, uh, every Korean should join the government healthcare system.
Okay.
Yes, so they should pay the maybe 10% of the income to
Mm-hmm.
pay the healthcare system.
Okay.
But the very low income person, yes, give uh, by the government like Medicare in the US.
Okay.
Yes.
So insurance
Yeah.
works for all? Is there an insurance coverage for everyone in Korea?
Oh no, no, not everyone. Only the government want to cover everything, but the source is limited. So I know the half are covered by the government,
Okay.
like colon cancer, more breast cancer. Like cancer is covered by government, but spine surgery is not covered. Only maybe half.
Okay. Okay.
Yeah.
So how is the spine surgery training in Korea? Like after your residency, how long is your residency and how long you had to train to become a neurosurgeon?
Thank you. Yeah. In Korea, we have a not medical school system, only college.
Mm-hmm.
After the high school, we
Mm-hmm.
enter the College of Medicine in 6 years.
Okay.
Yeah, there is 6 years, and after that, we should test the medical license.
Okay.
Yeah, so medical doctor license. So
Mm-hmm.
after that, we can do the GP,
Mm-hmm.
yeah, GP or training the
Okay. Specialty training.
yes, yeah. So
Okay.
we have a 1 year intern and 4 year residency. But now some departments have only 3 year residency.
Okay.
Pediatrics, internal medicine have 3 years, but majority is 4 years. After that, some need to learn more. They choose the fellowship,
Okay.
1 to 2 year. Yes,
Mhm. So choosing a fellowship is totally optional, is it? If you want to be a
yes,
fellow, you can be a fellow.
totally optional. Yes, totally optional.
Okay.
And generally want to working at the university hospital, we should choose the fellowship.
Fellowship. Okay. Like, what are the opportunities by which Korean post-residency person can enter into a fellowship? Or if a person from abroad who has done his residency and wants to do a fellowship in Korea, how can he enter into the fellowship?
Yes, that's a good question, and I think some people in your country have a question about that. In fact, in Korea is not country come from other country.
Mm-hmm.
In fact, for the maybe last 10 years,
Okay.
but after the endoscopic surgery is very interested in Korea.
Okay.
So many people want to come Korea
Okay.
and run from Korea. I think, but in legally without the Korean doctor license, they cannot do the medical procedure in Korea.
Okay.
I know,
Mm-hmm.
but the very limited country license can use in our country.
Okay.
I heard about that, but
Okay.
I don't know the exact country. But the fellowship system exists in our hospital, like in our hospital. Dr. Satishi, you are like you.
Yeah.
AO Spine fellowship is in Korea. Maybe 4 hospitals join the AO Spine fellowship
Okay.
system in
So
Korea.
AO Spine is one way by which we can enter into fellowship in Korea.
Yes, one major way.
Okay.
And without that, maybe
Okay. With
personally,
personal reference, we can
yeah,
enter. Okay. If
Yeah,
you know
yeah.
the
Personally,
mentor,
I
you
think.
can ask him and enter.
Yes, that's right. That's right.
Okay.
Yeah,
Okay. Is there
yeah.
any association like apart from AO Spine, like a Korean Orthopedic Association or Korean Neurosurgical Society? Do they offer any fellowships?
Yeah, I don't know exactly, but maybe there are in the Korean Orthopedic Association because in our hospital, the orthopedic department, I see the one or two fellowship from the uh, outside country.
Mm-hmm.
They working at our hospital for 1 or 2 years.
2 years.
But
Okay. Hmm.
yes, but our orthopedic department is not in the AO Spine fellowship
Okay.
program.
Okay.
Yeah, I think the other way is exist.
So there are other ways exist to enter into doing
Yeah,
fellowship.
yes,
Okay. Okay.
long time fellowship, I think.
Okay. So your practice is like, will you be shifting between university and private, or it is only university and only private? How does it work in Korea?
Practice.
Practice, yeah.
Like you.
Yeah.
Yeah, it is not allowed in Korea.
Mm-hmm.
Yeah, for me or for the public hospital, private hospital, in one license, they should work in one hospital.
Okay.
It is legally. Yes.
Mm-hmm.
I don't
Okay.
know why.
Okay. Okay.
Yeah.
Okay. So, like, is there any rotating fellowship or a traveling fellowship available in Korea? Like multiple centers integrated into one fellowship? Is there anything like that in Korea?
Yes, some hospital, in fact, in our hospital is the branch of the Yonsei University.
Mm-hmm.
Yonsei University have the three hospital.
Okay.
So, for the maybe 10 years ago, our fellows are rotated to yes each hospital.
Okay. Then they will
For
rotate, is
3
it?
or
They will rotate
yeah,
from
yes,
one hospital to other.
yeah, but it is stopped.
Okay.
But because every professor want to have a own fellowship uh,
Okay. Okay.
longer.
So
Yeah,
fellows,
but
so
yeah,
fellows can be rotated within the same institute, and it is totally depend upon the institute's policy to rotate it or not.
yes.
Okay.
In Korea, 2 or 3 university hospital is a special system, the
Mhm.
neurosurgery and orthopedic rotation fellowship.
Oh, okay. Okay.
Yeah, yeah, they are very familiar each other.
Okay. Okay.
Yeah,
Okay. That's great. How is
yeah.
the work-life balance in Korea? Like, how long is the work time? How long is the home time you can invade?
Yeah, thank you. I think I'm working very hard, but we have only 5 days working 5 days a week. So
Okay.
Saturday and Sunday is a weekend.
Okay.
So yeah, it's a holiday. So we work only 5 days a week.
Mm-hmm.
But ordinary we start a meeting from 7 a.m.
Mm-hmm.
7 a.m. to ordinary I go home from 6 to 8 p.m.
PM.
Yeah.
Okay.
If I had a many surgery day, so I go home late, but
Okay.
ordinary
Okay.
and
So,
yeah,
like,
so
if a surgeon from India wants to settle in Korea, is it possible?
settle. I think it could in future because I think Korea is not the multi-social nation
Mm-hmm.
now,
Mm-hmm.
but the percentage of the outside country the person is very steeply increasing. So
Mm-hmm.
I heard that now the more 10% is the non-Korean, yeah,
Okay.
non-Korean region. So I think someday Indian or other country could work in Korea, and
So
it
right
it will
now
be
it is not
needed.
possible, is
Yeah.
it?
It is possible. It is
Possible.
possible,
Okay.
but you should work in the study at the Korean University Hospital.
Mm-hmm.
No, I'm sorry. You used to test the Korean doctor exam.
Okay. Okay.
Yeah,
So you
from
had to
from
clear the
there.
exams before we
Yeah,
can
yeah,
practice
yeah,
here. Okay.
yeah.
Okay.
Because the needs are more increasing.
Okay. That's great.
Yes,
So the need is high, but still, right now, you have to clear the exams so that we can practice in and settle down in Korea. So, regarding
right,
the
right.
language restrictions, is there a necessity to know Korean for the
Yeah,
fellows?
yes. It is a major problem now. Major problem maybe. So because as you can see the in the surgical field or everywhere, every Korean talk with the Korean. Uh, but in Korea, some city majority is Chinese.
Okay.
Some city majority is Vietnam.
Mm-hmm.
Some city, yeah, majority is the U.S. So, the city we go to the city, we should change the language.
Oh,
So I
okay.
think yeah, someday it will be changing, but now it is a big goal. I think
Okay. Okay. So, it's better to learn Korean if you are planning to settle down on a long term in Korea.
yes, maybe.
Okay. Okay. So, like, if you are offering a fellowship, like you are a mentor, and if you want an international fellow to train under you, what are the qualities you will see in his CV or as a personality to take him as a fellow?
Yeah, yes. I think nationality is not important. Everywhere we surely welcome.
Mm-hmm.
But the as you know, the many Korean do speak very well.
Yeah.
Yeah. So some like me. So English is so short and but the from abroad uh they can do some English.
Okay. So,
So
if an
we can
applicant
communicate.
knows Korean, then it's fine, right? It's welcome,
That's fine. But I think it is
not a mandatory.
really yeah we cannot do
Okay.
yeah but it is very interesting because we can talk with the Korean
Okay.
and Korean language. Yeah,
Okay.
it is good. Yeah.
Okay. Like, do you want the applicants to have previous experience? Like, do they need a couple of years of experience to be a fellow in Korea?
For the abroad fellowship, I think the some experienced person is better. Yeah,
Okay.
2 or 3 is perfect.
Okay.
Yeah, because they saw surgery from their country
Mm-hmm.
uh, institution and they can compare the
Yeah.
surgical technique and
Mm-hmm.
strategy. I think it is perfect.
Okay.
But no experience, I think it can be, but the better is experience.
Okay. Thank you. Thank you so much for that. The next question is about the technology. Like, how far is technology integrated into the spine surgery practice here? Do you like commonly use robots? Do you commonly use 3D printed implants? Do you use AI diagnostics? Is there anything available of that sort in Korea right now?
Yes. Thank you for your question. I'm sorry. The technology integration is the worldwidely very fastly developed.
Mm-hmm.
So in Korean, spinal surgeons struggle to some person working try to the robotics and some surgeon try to have a AI and
Mm-hmm.
some person trying to 3D printing,
Mm-hmm.
but the majority is doing only a classical
Okay,
surgery.
traditional approach.
Yeah, I think the technology developing in worldwidely. I think
Okay, so Korea is
yeah,
adapting too.
yes, adapting.
Okay, okay.
Yeah.
So if a fellow joins a Korean institute, is there any Korean cultural norm he has to be mindful about? Like, is there any Korean
Mm,
culture that he must know so that he is not being under any untoward experience?
I think from India, the Asians have something familiar things.
Okay, okay.
As you can feel, it is the Asian culture is the different with the European or
Yeah,
American
yeah.
culture.
Mhm.
So it is easy to
Easy to adapt.
working and living together. I
Okay,
think it is good. Yeah,
okay,
the good in your country is good in Korea. I think.
okay,
Yeah,
okay.
yeah,
So it's adaptable. So
yeah.
nothing grossly different
Yes,
going
yes.
to happen here.
They
Okay,
that's right. That's right.
okay, okay. So in the next 5 years, where do you see the spine surgeries progressing in Korea?
Korea in Korea, majority of the fusion surgery is performed in only university surgery,
Mm-hmm.
but the surgeon in university hospital is only 10 to 20%.
Okay,
Yeah, so the majority is working on the private hospital.
okay,
So they want to do surgery. So they are developing endoscopic surgery and MIS surgery.
mm-hmm.
So I think Korea are very interested in MIS surgery, especially. I think
Okay,
so. I think in Korea, with Korea, the global focus are maybe come to a MIS surgery
MIS
or
and
and
endoscopy.
endoscopy also.
Okay.
And yeah, I think you say the maybe I think the something research and
Yeah, yeah.
biomechanics
Are
and
you,
AI
yeah,
will
is
yeah
research a part of a fellow who is working in Korea, and how far research is being valued in Korea?
research research is always I think important for the university or public hospital.
Mhm.
I was very surprised for you. So you are better than all of us. I was very surprised. Yeah, surprised
Okay,
and
okay. So from your previous
yeah,
answer, one thing what we got to know clearly is 20% of the surgeons work in university hospitals and 80% of
yeah,
surgeons work in private hospitals. And most of the fusion surgeries are happening in university hospitals. And most
yes,
of
that's right.
the private hospitals prefer MIS surgeries and endoscopic surgeries.
Yes, that's right.
So
That's right.
Korea is progressing fast in endoscopic and MIS because 80% of the surgeons are working in the private towards all the
Work.
MIS surgeries and endoscopic surgeries.
Oh yes, working with endoscopy surgery, and they want to cure patients with the endoscopy surgery because the mostly patients want to
Yeah,
the
patient wants
private
MIS and
hospital.
endoscopic
Yes,
treatments.
yes,
Okay.
yes.
Almost we covered all the aspects of today's questions, I guess. Thank you so
Thank
much
you,
for spending your time and giving us your valuable insights about fellowship opportunities and medical career and the medical fraternity in Korea and their aspect and the views towards international fellows. Thank you so much, Professor. Thank you.
thank you, and finally, Riverside, I want to go to India for the learning about your country
Yeah.
someday.
Yeah,
Thank
sure.
you,
You're most welcome.
thank you so much.
Thank you. Thank you so much.